Okay, Doug Moglen,
Here.
Carl Steinhardt,
Here.
Charles Dunlap,
Here.
Russ Anderson,
Here.
Rich Stefanowitz. Is he here?
He's on mute.
You're on mute.
Yeah, hello here.
Tammy Spencer,
Here.
Rhett Banish,
Here.
Mark Siegel. He's not here, is he?
Not here.
Randy Brown,
Here.
Cindy Sullivan here, Jennifer Willard,
Here.
Stephen Presnell,
Here.
Dennis Clark,
Here.
John Kane, Bruce Besser. I don't know how to say his last name.
Braseri.
Here. Donald Rickson. And Karen
Zorik.
Dorick.
Here.
Okay. So there's only one person who hasn't been sworn in. We'll do so
Shame.
tomorrow.
Shame. It's me. It's tomorrow. Sorry.
I'm trying not to shame you there.
Shame
Jen.
away. Shame away. If that's the worst thing people say about me today, it's a banner
That's
day.
right, today, right? Okay. So we have a quorum.
Okay, I guess we will call the meeting to order. And it looks like the first thing on the agenda is the acceptance of the Thursday, October 22nd, 2020 minutes. In reviewing those, I did find one little discrepancy in there. As it actually relates to me, I'm not a lieutenant, so.
Oh,
other than that,
whoops.
it looked good to me.
I'll change that. So does someone want to go ahead, Brett? You want to, Rhett?
Rhett would
When you
call
start
for a
running-
motion to accept them.
So with that change, I will take a motion to accept.
I'll make the motion.
Is there a
I'll
second?
second.
Said
All in
second.
favor,
Who
need a
said
roll
that?
call on it?
I was Randy.
Carl, do we need a roll call on the acceptance?
Yes,
Yep.
you do. So
Okay.
Cindy will read the name.
Yeah. Doug Moglen,
Mute.
you have to unmute yourselves.
Yes.
Carl Steinhardt,
Yes.
Charles Dunlap,
Yes.
Russell Anderson,
Yes.
Rich Stefanowitz,
Yes.
Tammy Spencer,
Yes.
Rhett Banish,
Yes.
Randy Brown,
Yes.
Cindy Sullivan, yes. Jennifer is non-voting.
Abstaining.
Jennifer, you'll abstain, right?
Yep.
Can she even do that, or does she just not say anything? I don't remember. Stephen Presnell,
Yes.
Dennis Clark,
Yes.
and Karen Zorick.
Yes.
Okay, motion passes. Let's move on to new business. We've got a COVID-19 update and discussion with Tammy Spencer.
Alrighty, okay. So I have tentatively what the data might look like tomorrow based off of the previous 2 weeks. So for the previous 2 weeks, it looks like we had about 43 cases, with last week having 20, which if this is correct, when they report it tonight, will have us under 25, which will be out of the red.
25, I'm sorry, 25 for 2 weeks or?
No, 43 for 2 weeks, but it is 25 a week.
It's only 25 a week. It doesn't have to be 25 total.
So we had, that's, oh my God, that's what it is, right? It's 25 per week, right? Oh my God, what is it?
I thought it was 25 in 2 weeks, but I could be wrong.
Oh. Well, we only had 20 this week, last week, which is unbelievable because we were having weeks that were like 60. I think it's per week, not per 2 weeks. Because that's
Tammy, you're making me the happiest superintendent in Massachusetts right now. So I'm just
okay.
going to go with it and live in this fairyland for as long as I possibly can. So just keep going.
And we have based off of that data, we have a 5.24% positivity rate. Let me share my screen. Oh, can the host enable sharing? Bless you.
Someone know how to do that? Carl, do you know how to do that? Do I have to do that?
What is the question?
You have to do it. You have to
Enable share.
make her a host. Just right click on her name in the attendees list and make her a host.
And it didn't work. Allow,
Not
rename, put in waiting room, remove report, chat. It's not giving me that option.
Who's the host of this thing?
I
You are.
am, but
Who did you
it's
make the
not
call?
letting
Mo?
me. You, I think I always put you, Carl.
You did? Okay, so I'm trying to find out under, so go under participants, Doug, and then I would, let's see, take Tammy and see what, allow her to multi-pin, make co-host.
Yes, just make her a co-host. That should work.
Make her a co-host, okay.
Yeah,
See what-
I don't have that option for some reason.
Yep.
I don't know
I
why.
just did that, sir.
See if that works, Tammy.
Tammy, does that work now for you?
It does. It does.
All right, see, we did it. You know, the advice of the chairman.
Let's see.
That's the high of my day. I'm leaving now.
For some reason, I cannot pin the pictures to the front, like to come to the front. So that's why it looks a little messy on here. Okay, so Kate made this, our public health nurse made this lovely graph. This represents the end of last week. So Kate gives her numbers based off of, I think, Thursday night every week. So this is based off of last week. So if you go to January, you'll have to add at least, I don't know how many for the next couple of days. I only did to Sunday. So you'll be up a little bit more than 73. We're probably closer to maybe in the mid 80s. But you can kind of see if you go back from March, how unbelievably different the spring when we had everything completely closed, how different it is from after Halloween. So when you look at the brown, that's Halloween, that's October. That last week of October is when, after Halloween, is when the numbers started to really kick up. And November being our highest month, moving into Christmas. And then the bulk of January really was the first 2 weeks. The cases were unbelievable. We were having 67 was our highest week. So while January might not be our highest month, our highest weeks were in January. But it is looking like we're coming back down, which is very hopeful, very, very hopeful. Just the amount of work that Kate has been doing, we had to rely on the CTC to do a lot of our contact tracing. Mostly now when we rely on the CTC, it's not for calling up our positive cases, but for referring the positive cases to have their contacts call the CTC. So Kate likes to keep track of the actual cases herself. Let's see. I got rid of that. So while the holidays was a kind of a pretty negative trend, right now it's looking good. My fingers are crossed. I'm knocking on everything. And let's see, I'll stop this for now. So I guess the next big topic is vaccines. As most people heard on Monday, the governor sort of rearranged the vaccine distribution schedule. Let me pop that one up too. Hold on. So some of you saw this yesterday when we had a brief meeting for discussing vaccines. So now, so currently we are still in phase one. Phase one will probably go on for the next 6 months. So while people think that phase one ends when phase two begins, it's really not true. In order to catch all these people in all these areas, healthcare, whatnot, this will be a long task. This is something that will continue to go. But the governor did approve for phase two to begin on February 1st. It still starts off with individuals 75 and up, but now they have bumped up individuals 65 and up and those with comorbidities over that third area, which is sort of a slightly higher risk occupational exposure. And then the one comorbidity is still at the end of it. They also have broken down phase two. Where is that? This is not the phase two timeline. Sorry about that. I don't mean to make everybody nauseous doing that. Let's see. Hold on 1 minute. Hold on. Sorry about that. Is my screen being shared right now? No.
No.
Okay. I can't get back to the. Oh, where is it? I can't get back to Zoom.
Really? Let me see if I can put you back in there.
Oh, I got it. I got it.
Okay.
I got it. I am not good at multi-screens over here. You guys did not hire me for my computer skills. I just want you to know. Okay. So this is where we are right now and sort of the priority statuses within each individual phase. So right now, all priority statuses in phase one are eligible. So if you fall in one of those groups, you are eligible to get a vaccine. And then next week begins phase two. And this kind of just does a nice breakdown of what we said on the last slide. So individuals age 75 and above can start. Yesterday, a lot of the portals for the regional sites opened up and they got overwhelmed very quickly. And so people who are trying to call right now or sign up more than likely will not be able to, just because they've already overwhelmed and they've gone past the number that the state's been allotted for a lot of the regional sites. Let's see. I also have, hold on. I also have the map. If anyone has seen this already. So when you do go to the link on the mass.gov's COVID-19 vaccination page, if you go there and you can check out the vaccination sites. So these are all public sites. So when you click on them, let's see, we'll click on this one. This one is the Stop and Shop in Feeding Hills. I think I was told by Charlie yesterday you had to sign up wearing it with your Stop and Shop card. So that was kind of an issue with that. But as you go in, so these are ones that are open. I believe these are the ones that I'm on the page for 75 and above. So Trinity, Bay State, and then next week, Eastville Mall will be open as a regional site. So there are places. We also are trying to remind people that doctors' offices should be carrying them soon. I haven't heard from our pharmacies yet. I put out emails to ask when they're opening. They're up to the public, and I think some of them are. If you go on their websites, like you can sign up but I think they're already full at CVS and Walgreens. So there are going to be lots of options for people to get the vaccine.
Tammy, one thing that the commissioner was explaining to us yesterday was that these colors mean something. So one is like,
They do.
anybody can go. One is for only people in a certain town can go. And there's a table for what each color is.
Yeah, so it'll say, so this one is the Eastfield Mall one, serves eligible populations statewide. Eligible populations, oops, sorry. And I think I think they get off the list when they're overwhelmed, because there are, like yesterday, different stars all over here. I would go look for the table, but I think that it's just a lot of me shifting around here. But you can also, oops. You can also, there is a document. I don't know where that is. There is, you can, underneath the map, you can download an actual list. So if it makes it easier to download that, keep that every day, if you are fielding a phone call or whatnot, to have the list out by town, and it'll show where the different clinics are. So Amherst has the regional clinic, Eastfield Mall will have the regional clinic, and those all are going to be open. I've been hearing from people that people with comorbidities have been receiving vaccines at their primary care or their specialist offices. So every doctor's office is different, because other people I talk to, like my mother, who has probably 5 different comorbidities, called her specialists, and they're like, what kind of vaccine are you looking for? So I think that we're, depending on where you go, you'll get a different answer. So that aside, what we have started to work on our plan for vaccination clinics here in town. We are starting with the 75 and above. We'll find out on Monday. So if we hadn't set up a clinic yet, which we hadn't, because for the first responders, while we were part of Agawam's process, technically Southwick hadn't set up a clinic. So for those people who hadn't, we have to wait till Monday morning, the 1st, to get, the 4th, to get a survey. And when that survey comes in Monday morning, we have to fill it out for the request for what population we're filling, how many doses we're looking for, and then we send that back to the state. And then later on in the week, the state will tell us, yes, you're receiving vaccine, no, you're not. If you are, you'll be receiving this many. When we go from there, then we'll call it's create a clinic online. So through the state's PrepMod account, we'll create a clinic, and based off of that, there'll be a certain number of slots based off of our allotment. And then people will be able to go and go online and fill it out. What we're working on right now, Cindy Sullivan is helping us. The state is coming up with some options, and I'm working with my part-time secretary to see how we can set up options, is for a call-in line. I do not want to rely on the call-in line, because it is more work for us. I want to stress that to people that if they have loved ones that fit in that category, that are 75 and above, and they have the means to help them do it online, it will make it much easier. And it would guarantee them a quicker spot than calling and going through that process. So I'm kind of trying to come up with a plan right now to cover that area, but we really won't know how it will go forward until we find out if we're getting doses or how many. Cindy Sullivan has just been really helping me out a lot in this area, because I think if there's anybody who knows this, this community, this 75 and up, 65 and up, it's Cindy. So we're kind of working on how to set up a clinic, where we'd like it to be set up, and the flow and everything. And yesterday I met with the chiefs and Charlie and Carl and Doug and Deputy Chief Stefanowitz to kind of hash out how how we're going to utilize staff, how we're going to utilize fire and police to run the clinics. And I'm so glad you guys are involved, because I go from 1 minute feeling very confident about this to the next just feeling so overwhelmed. But you guys are awesome, and you've had my back on this, so it's been so great. And I feel like that's almost everything I've got out on that topic. If anyone wants to open it up or to ask me questions, feel free.
Cindy, I'm sorry, Tammy and Cindy at the same time. Is there any way that we can come up with a universal message about where we are right now and kind of like the calendar? Because we've already gotten calls. People are frustrated. They don't know who to call. So, you know, I got 2 of them yesterday. One woman was almost 20 minutes on the phone just trying to talk her off the ledge. And so if we just had a universal message so that if we're fielding calls from people, because you know what they're going to do. They're not going to get the answer at fire. They're going to call dispatch. They're not get the answer they want. They're going to call DPW. Who knows? But I think if we all had that same message.
I apologize, Rich. I did give that message to offices within this building, but it wasn't helpful. I mean, it was, but it wasn't. I did not think about sending it over to you and to fire and police. But the message has changed. And actually, that's what I've been working on the last 2 days is a message that we can put out on Code Red, which would be okay, right, Carl? Like, even though this is a real piece of information where I'm telling anybody to sign up. Be okay
Yeah, if you want to place something on there, you know, Rhett or the fire chief can help you put out a Code Red call.
I think I might have to have Rhett help me again, but I think I remember how to do it. I have all this stuff laid out from the wonderful mask phone call I had to do earlier on in the year. But yeah, that's what I've been trying to put together. Won't lie, I think I might be like drawing from some other towns I had seen on Facebook and what their message was. But I think now that we know we will be able to, there's no guarantee about how many doses we'll get, but we will be able to get it. I would like to put something out, but I will forward you fire and police kind of what the tentative sort of what we've been telling people in the meantime. I mean, it's not them. People still don't like the message just because it's still, you know, we don't absolutely know, but so I'll get that too. And that's what I'm working on is the message to the town today. And
Oh, Tammy, can I butt in?
yeah.
So that's a really good question. Our phone has been blowing up for days, especially since Western Mass News put on that senior centers were helping people. So, which is great. So what we decided, I talked to Tammy yesterday, is I made an event in our software we're asking people to just hang tight, be patient. We're taking their name and putting it into our system just so I have like a running list of people who are calling, because I feel like decreasing their anxiety right now is the better way to approach it rather than just saying, just wait, we'll let you know, which is also an okay message. But I think the calls that I've taken today and yesterday, I think that has helped with saying we're working with the Board of Health to come up with a plan, but a lot of it is contingent on the state, which they're so sick of hearing at this point. And I said I'm just very honest. I just say to them, we all do, all the staff here, we don't know how many vaccines we will be receiving, so we don't want to make promises that we can't keep. And as long as we're giving them that information, they seem to be okay. So I would say if police and fire are hearing from seniors, go ahead and give them our number and have them call here, because I think once they get on a list, it's not registering them for the vaccine, and I'm making sure they're signed up for Code Red, telling them to listen to the Code Red message when it comes in instead of just hanging up, because that will have information. I'm not going to send out anything on my system until Tammy tells me to. But I'm making sure that people are signed up for Code Red, which we can do that for them. And the whole email thing is a whole issue across the country with seniors. And I know I'm on a call tomorrow at 3 with the state to help figure that out or hear a webinar on it. That I think they're trying to eliminate the email address on the state website so that people can get past that. So I just said this morning, like, let's wait a couple days and let the state figure out their bugs. But hang tight because Southwick's going to try to take care of you guys.
And then Tammy, yesterday, based on the meeting we had, I thought about it more. I think a 1-800 number would be a very good way to go if we can do that. Because Carl, would there be CARES money to cover staffing for that?
Well, we just got a confirmation where FEMA had stated that anything related to the vaccination process after January 21st would be 100% paid by them, not 75. And Kristen, maybe you can confirm that, but that was what we had got from their source. And then we confirmed that with Brendan Sweeney of Administration and Finance, and he told us to just go ahead and make sure that the Board of Health, does everything pursuant to the Department of Public Health rules and guidelines, which we are here. So this is important that we do that, and that's part of the cost.
So I think the 1-800 number, if we can cover it from 8A to 8P or something like that, would be very convenient. I don't know how many calls you're going to get in on it, but at least it's an avenue for people that are struggling with the emails or the websites to try to figure out what they need to do. It's a good way to get them through it and started.
Well, who's manning this 1-800 number? Is this a service that people can?
Well,
Let me pull it back just 1 second. So the state is working on a 1-800 number that will accompany the system. It's not out yet, but they are going to be working on it. There was no speculation as to will it be out in time for their first clinics, but there will be a 1-800 number, but
I
actually.
misunderstood. I thought that was going to be something we had to do locally to get.
No,
Okay.
no, not us, thankfully.
All right.
It's fantastic. But what so Jess Pelly is the Board of Health Secretary who works 5 hours a week for the Board of Health. So that is my only actual staff that I have that works here in the building. Karen is not a Board of Health Secretary. Karen is a building department secretary. So Jess does drive buses in the morning and the afternoon, and she has agreed that if I need to, she would come in for maybe say from 9 to 12, and we could have a 9 to 12, once we get up to being able to register, that people could call that her number or so, which I know Doug, we talked about maybe having a dedicated, is Doug still there? No, he's
Where
gone.
did that go?
Yeah, it's funny how he just kind of disappeared.
Yeah, we've lost the fire chief and the chair.
Wow, I'm really scaring everybody off. She's going to ask for more stuff. We're going.
I don't know where they went.
But Jess would be willing to sneak in a couple hours. So like, say we find out on a Thursday that we'll be able to get a vaccine for the next week. We could probably sneak in maybe 3 hours on a Friday and 3 hours on that Monday and have people call that number, and Jess can help answer. And same thing, we're trying to get Cindy trained too, to be able to put people's information into the database.
Yeah, and Cindy, if you needed to use some of your hourly rate staff members for additional hours to help support Tammy on that, you can do that too.
Yeah, they're gonna call here no matter what. That's the problem. Like, no matter what, they're gonna call here. So that's why I just started taking names to make them feel better, because it just relieves their anxiety. But I am telling them to listen to what the message says. Anything that has to do with a computer, most of the 75 and overs are going to call us because they don't have it. And you're right, asking their family to do it is working on some level, but there's still going to be a lot of people who just don't have that availability.
Cindy, what number do you want them to call?
569-5498.
Thank you.
Just stress that if you are sending people to Cindy, it is not to get on a list to register. It's only to get a personal phone call from Cindy when we have information.
Everybody will be getting a code red when it comes out, but this is sort of in order to make them feel a little less anxious. I request nobody else actually take down numbers and names, like, because, you know, Cindy's doing this as part of her service. I don't want anyone to have any false ideas that they're getting put on some sort of list. Because
Right.
even if we started a list right now, because it's going to be not many, but it will be several weeks before we even think about a clinic. A lot of those people could have already gone to their doctor's offices or one of the variety of other places, which is why I'm hesitant to make a list to begin with.
But I think people in Southwick want us to do it. They're used to that. So, and that's probably my fault. But they are used to us kind of taking care of their needs. And I think the Eastfield Mall is going to be an absolute nightmare. So I would prefer, so I'm just encouraging them to hold tight and wait. And it could be, even when we start clinics, it could be 2 clinics a week, right? I mean, we don't know what that's going to be. Ludlow, for example, their senior center was told they're getting 14 doses a week.
14.
But West Springfield was told they're getting 100. So every senior center is being told, every community is being told something different. But Ludlow is they have a huge amount of seniors and they're getting 14. That is a
So
crazy number.
we're getting 6.
Yeah. So I don't know.
I don't know how they even got a number. Oh, maybe they were registered as a first responder clinic. That makes sense.
It could have been. So West Springfield I'm on this email with like 500 people from the state. So everyone replies all, which means my phone's blowing up every, 2 minutes.
Nice.
So I'm getting like different information from different senior centers. And then there's some senior centers who want nothing to, like, they're not doing it. They don't have the capacity to do it, but they're getting bombarded with phone calls too. So it's just being very patient with people, that they're frustrated. They don't have computers. They are very confused. So I just had a little meeting with my staff this morning and said, just be patient. They might call a few times. So I think that's the best that we can do.
Yeah. They're calling every department.
I know they are. I know.
I know the clerks are getting calls and the select board's office are getting calls and DPW is even getting calls. So
we all share in this misery that is fielding these phone calls. But, I hope on Monday everything goes well and at least we'll be able to get that in and then hopefully get our number by the end of the week. If we get a number. That way, at least there'll be something to say that, okay, it started. And even if it's only 20 people or something, at least we can say it started and we won't have to hold up a clinic for a whole day, which would be nice. But anything else?
So I know we're talking about the 75 plus over vaccine and doing it for our elders, but I know you're also working with our lead nurse on getting a vaccination plan ready for our educational staff because they are number 3 in phase 2. Are you hearing the same thing about limited number of vaccines coming for teaching staff as well?
I would say so. So the number, I think we had over like a 260 something for staff number for the school department.
Mm-hmm.
I would say that if we were being optimistic, each time we got a shipment for the school department, I would say we'll get 100. So what Marcia and Lamoureux and I kind of walked through and talked about yesterday morning is maybe these will just be sort of Wednesday afternoon at each school based off of priority. And I mean, in my mind, I would think, so Woodland's open, starting with Woodland first and then kind of determining whether or not you thought Powder Mill or the regional school. So that way, you know, we would go, I feel like we started, I mean, by all means, if you wanted to start picking and choosing staff instead of going by school, I thought it seemed like a more fair way to go through it is maybe, so if we have to do it in 3 batches, just do it by, you know, employees for each school. And with, you know, with the nursing staff that you guys have, with hopefully maybe some help from both police and fire, I think that we can easily go through it. And let me tell you, if you've got some staff that can't navigate the website, I'm going to be questioning.
Us, we can.
Yeah, no, we're not going to have an issue with sign up and whatnot for you guys. And it'll go a lot faster. We'll be able to go through, like, so our estimate for the senior citizens is 16 doses an hour. I think we could do quite a bit more for a different type of, for a below 65 clinic than and above.
So my question to you is, how many people do you have doing the vaccinations for the senior center?
I think I'm not mirrored, so I can't tell which one.
4.
I think 4 is probably a good amount for the throughput. If you want it to go, so ours is 4 vaccinators for the seniors at 15 minutes apiece. You could do 4 at less than 10, but the way that we set it up on the prep mod is by minute increments. So you'll say, you have this many doses, you have this many vaccinators. How many minutes do you want to give each vaccinator? And I think there might be a time, do you want to take an hour out for break or shift change or something like that? So you can add more into that than what we've got. If there
My only thought was, if we are still in remote, and I'm hoping we're not on Monday, I wonder if our nurses are still in a remote status. I would be more than happy. I don't know what the union would say, but if possible, we're there if you need additional vaccinators. So
And that would
hesitate to ask me.
That would be amazing. And I mean, I don't know if there's something that we can do, the FEMA reimbursement wise or whatnot, but
we'll be at your schools if you want to come. Kate and I will.
Don't hesitate to ask us if you need stuff right now,
Yeah.
especially if we're in remote. I mean, we hired an extra nurse for this year. We have good nurses, and they're not super busy right now, especially with the flu vaccine being no longer mandatory. COVID cases are non-existent this week, so let's see what we can do to help you if we're not back in school next week.
thank you.
I'm
I
feeling
appreciate
we're gonna
that.
miss it. Okay.
Kate is trying to get passwords for the prep mod system for Marsha, for Cindy, for my Jess, so that there'll be multiple people that can navigate it. Because also part of the process is to have a tablet or a laptop there, which Doug isn't here anymore, is he? He's still not here. Okay. Every time I have technological questions, I'm looking for him. But
Excuse me, Tammy, do you need Jim to give you a laptop for this, or?
So this is how they'll be run. So when you come in, you will have already pre-registered. There will be someone at the registration desk who will pull up the list for the clinic that day, and will say, oh, you're here, click. And then when you're done, there will be someone that'll say, dose delivered, click. So that could be one person, that could be 2 people. So that could be just one laptop. Or if we have 2 people who are trained on it at the site, that, you know, it could be even faster. Like if we're really trying to go through and get people through, it could be, you know, one person at one door and one person at the other door. So
Okay, well, I'll.
So I have a laptop, and I said I was happy to help too at the
Right.
schools. When we
And
do
we
it,
have- We have an extra Chromebook here, so I'll have that
Oh,
brought to
good.
the office, okay?
Like, I don't think we need to buy anything, but if anybody just
No, we have it. We'll have, just
majority
have
of their
it.
work on.
Right, no, we have an extra one here that Doug had loaned us, so we will bring it up to you today.
But
perfect. I mean, as you know, as long as there's Wi-Fi and everything, and like this building I know does, and I'm sure.
Oh, yeah, you've got it in the building.
So it should, while the system is a pain for people who aren't internet savvy, this really brings the sting down for people who are trying to set up clinics that do not do this on a daily basis. This really isn't an issue for, say, like a doctor's office who does their billing and that they're set up to make money. So we're not set up to make money. It's not how we operate. So having this system, even though it might be a pain for some people, it's really the way that we are going to be able to get through it without having to do billing on our end, and being able to rely on the state to help out with that. So, but it does make it a lot easier. So,
Give me a couple of things.
are on that
The
list.
Agawam Clinic, when they did it, their check-in was like you were going to vote. They had tables set up with people with pads and with hard copies of just a printout. And they checked people off that had come in, got the vaccination, and then you were told to wait 15 minutes, and then you kind of self-dismissed. So I don't necessarily know that we have to have somebody staffing a laptop at that point. They were going back and putting all the data in, which allowed them to really move through and get people moving through the door, rather than relying on, a computer that might fail or lose access, or, have to go through several pages just to check somebody off. And it was done afterwards. So somebody could probably do, if you're doing 20 a day, it's not going to take long to do that input.
Yeah. So like for the senior center, I was just really thinking of having the one laptop there. And then, Kate is going to give a sheet, with the counterindications and everything like that on their way out.
Mhm.
That would come back to the front desk, and I would put it back in the system. So I wouldn't really do I would do it more like you said for that. But if we were like talking about major throughput and we just had somebody there click, I think it could easily be run too. But just kind of options. We'll see how our first clinics run for the seniors and whether or
The
not.
guinea pigs.
What?
We'll be the guinea pigs, no problem.
Yes, sorry. Well, no, they were already guinea pigs. Police and fire.
Oh, right, yeah.
They're going to get stuck again later this month.
Yeah.
Yeah.
We go next week. Jen, just quickly, what's the percentage of faculty and staff that have said that they want to get the vaccine versus those that have said no?
So we're collecting that data right now. And I had a meeting with our union yesterday afternoon. The majority of the staff want to get the vaccine. It's probably going to be about 90%, 95%.
That's great. Good.
Yeah.
And if I can ask, I was in contact with Marcia just to see, she asked if we had anything going on transportation end, and which we didn't, but I'm not sure if she submitted to you that we would be interested, but I did take a consensus, and we have probably like a 95%. So we've got like almost 30 people too that would be for drivers.
I think she gave me something like 26 or 28.
Yep.
Yeah.
So that's almost 100%. Yep.
So we could figure out which school has the smallest amount of staff.
Probably Powder Mill. Woodland actually has a greater amount than Powder Mill. I would say Powder Mill has at least.
So maybe, well, it depends on like how many we get at each one. So maybe we could pick a school to have the transportation department align with.
It's not that significant. It could be I would suggest with the location of the transportation department, I would do it at Woodland School.
Woodland School. Okay, so we can try to put those numbers together when we put the Woodland School numbers. Oh, this is a question that I think was asked about the cases on the buses. So we notify anybody that's a contact on the bus. Do we notify kind of similar to like how with the school in the classes, it's like, you are not your child was not a contact, but it's in your building or your school. Do we do that for the buses?
We did, but we haven't had that happen.
Okay.
So, but the one
Got it.
time we did at Powder Mill, and we thought that there was the potential of spread on the school bus, we did send that to parents on the bus if they were on the same bus with the kids.
That's what I had thought about it. Yeah.
So I have question just about the schools. When you're vaccinating, and I'm sure Jen has thought about this, but there are side effects. So I don't know how, and you guys will figure that out in terms of spreading it out so that not all of the staff in one building are getting vaccinated on the same day. We've thought about that here with splitting it when we get it, to not have all the staff on the same day in case there are some side effects and people need to be out for a day or so.
I'm actually going to just include that in our plan, because we're hearing it's not so much the first dose, we're hearing it's the second dose. And I was speaking with Sergeant Banish this morning, is it lieutenant or sergeant? Sergeant, okay, because you had me confused there.
I know, I'm sorry.
Okay, so Sergeant, and we were talking about it, and we have to include that in our plan because the second dose is making people pretty sick. So either we do it on a Friday, mass vaccination on a Friday, or we have to stagger it over the course of the week, because we can't have mass exodus of teachers out.
If, I talked to Marcia about that, about a Friday, if it maybe, just doing it with the schedules of the teachers or whatnot.
Right.
Might not be a bad idea. And then kind of some of the anecdotal stories I've been told is that people are feeling the side effects on the first dose if they were already positive. So it could be more people than we anticipate.
Mm-hmm.
But it's just mostly fevers and lethargy, but still enough to not make you want to stand in front of
Right.
screaming kids. Hopefully not screaming kids.
We were hoping we could get the vaccine during February vacation.
Oh,
I heard that from Westfield too, but I
that's
told
not
them,
gonna
I
happen.
told some teachers yesterday, no, that's not happening.
I think it looks more like March. If I were to kind of just in my head piece out like each, the waiting period before the first clinics, I think it was going to look like March before they rearranged it. I think it's still going to look more like March.
But I'm also don't get surprised when they change it. So maybe they will.
And we hear about it on the news like everybody else.
Yeah.
Why is such and such a town giving out vaccines and you're not? Oh, wow. Any other COVID-y related questions?
Tammy, just quickly, the last one I have is because we'd like to get back to training with the numbers starting to decline within the community. Are we still under some restrictions for numbers for aggregate groups?
Public safety never has.
Right, but we're more about the public perception, Fire department had 50 people together because they don't understand that we're exempt. I just
Yeah.
wanted to backlash.
So no, I mean, so no, you aren't under the exemption, but if you did want to be in line with the exemption, so till February 8th, indoor trainings or indoor meetings, it's still no more than 10 people.
And then after that, it's 25 or is it a
That-
percentage?
It's 25 for any type of like a group meeting. So
Perfect.
we'll just take for an example, let's see, I'm trying to think of, so you like take for example, I'm trying to think of a place that does both, like Tucker's. So once we get out of the temporary restrictions, which would be hopefully February 8th and February 8th or February 4th? No, February 4th, sorry. So hopefully after that, we'll go back to our phase 1, yada, yada, yada stuff. Like, so a restaurant could have as many people as they want, provided they do social distancing. But if you're going to have an event, so like say you wanted to use the space to have a training, you would be limited to 25 people for that event. So you could go out and do that. So it would be 25 for the non-public safety sector after this, as long as it doesn't get shifted 2 more weeks.
Right.
Yeah.
Thank you.
No problem. Well, that's it for me. I'm sure there's more, but.
Thanks, Tammy.
Mr. Chairman,
Yes.
Chairman Banish, I have to go off to another meeting. So obviously, I know you're going to have a very constructive conversation with Kristen. And by the way, Kristen, we hear that Patrick Carnival is back working with your agency now from the governor's office.
He is. We're very excited. So Patrick is now the deputy director of MEMA, which is very exciting. He started January 11th here. He's still doing 1 day a week with the governor's office as well. So he's doing that job plus the deputy director for MEMA. So we're very excited for that.
Good.
And one thing too, Carl, before you hop off, I did just want to confirm that you're correct about the FEMA reimbursement. So starting on January 21st through September 30th, 2021, the COVID vaccination costs will be covered 100% by FEMA. If there was any cost previous to that, it'll be 75%. But
Yeah.
one thing I will strongly recommend is that next week on February 4th, 11 a.m., FEMA's doing a webinar on this, and it's going to talk about what type of documentation you need, what is eligible. So if somebody or a couple
I
people are
believe
interested
Tammy knows
on
about that, right? Tammy, you've got that already on your list? Kristen,
Signed up.
Tammy and I have already been talking about, she's got that on her list.
Perfect. That'll be
And I don't believe we have incurred any costs before January 21st.
Okay, perfect. So that was a great thing to find out.
Okay.
Ready to buy supplies.
Right. Tell Patrick I said congratulations and thank you for joining this call today, Kirsten.
Oh, absolutely. Thank you so much.
Okay, bye.
And actually, is it okay if I do my update? Because I have another meeting. I was supposed to be on at 10 too. So I could just do my quick update. I apologize and I'll have to hop off onto something else.
Go ahead and roll right into it, Kristen.
Okay. So I mentioned about the FEMA, which is great information. Something else I want to talk about. So as far as the upcoming MEMA workshops that was on the agenda, right now, since we can't do as many in-person meetings with people in the communities or do trainings in person, we are doing monthly workshops that are going to be online through Microsoft Teams. Last month we did one. It was about community point of distribution sites, and talked about those, how to set them up, how to run them best. Excuse me. This month on February 24th, from 1 to 3 for Hampden County is where we're going to be doing our next workshop, and that one is going to be about putting together your continuity of operations plan, your COOP plan. We sent the information out to emergency management directors, but when I send out, probably going to do it today or tomorrow, a reminder, I'm going to include at least the head of government, so town manager, select board, in the reminder, because I do want to invite other departments if you're interested on hopping onto this workshop, because COOP plans include every department in the community. It's not just emergency management or public safety. So this is a workshop that, like I said, 24th of February. We're going to be doing it from 1 to 3. If you are interested, but if that for some reason that time frame doesn't work for you, just reach out to me, because we're doing other ones for the different counties in our Worcester, Mass and Central Mass area. So I could always send you the link to another one if that date and time doesn't work for you. Another thing I wanted to discuss real quick was that the recertification process for LEPCs and REPCs. So a lot of groups, pretty much every group, because of COVID, it's really set everybody back a little bit. We understand that, no big deal. Everybody's in the same boat right now as far as that goes. That being said, I'm on a working group now that just started. We had our first meeting last Friday within MEMA that we're going to be revising the whole certification process. It's actually going to be made a lot more simpler. So I wanted to let you know that that will be coming. We only had our first meeting, so I don't have any details on it yet. What I would say though, if you want to work towards being prepared to get recertified, definitely review and update your plan. No matter what we change the rest of it to, that's always going to be a must. So make sure to continue doing that. If you were interested in getting your recertification done before we come out with our new process, you can do that as well. We have had some groups that did get recertified. It's good for 5 years. They just did it. It's the same paperwork that we had, for the past 5 years. It hasn't changed. So you can do that too. That's an option for you. Just wanted to let you know that changes will be coming. Can't say exactly when it's going to happen, but they will be coming. We're working on that right now to make the process a lot more simple. So it's not as tedious to do all that paperwork. Trying to think of anything else. Oh, one thing I was thinking of when you guys are talking about information for, your people in your community calling for information regarding COVID vaccinations and such. If it's not, one thing too, you could think about letting people know is, I'm sure Mass 211, if you dial 211 for information, they probably have a lot of general information regarding COVID vaccines too. So if you don't want to be inundated with telephone calls that are just the kind of basic calls, that's something too that can be advertised out to the public, that they always can call 211 or go on mass.gov and a website, they have a computer and they're comfortable, because all the up-to-date information is posted on there. Lots of times, we go to the website ourselves to find out the information, because public health doesn't always, it seems like it gets posted out to the public before we even find out the new updated information. So, which I know I see people nodding their heads. Yeah.
It goes to the public the exact same time it goes to local boards of health.
Yep. And same with MEMA too, if it makes you feel any better, it's the same for us. So that's just another option too. I think that's all I had, unless, does anyone have any questions for me about anything before I hop off? I mean, the food programs, I know there was the food program email that was sent out to the emergency management. Public health had initially been given that program, but they kind of passed it to us. So I know they were sending out information through their teams as well. There's a food box program that's started. It was kind of just getting finalized in the past couple of weeks of the exact details of it. But basically, it's a food security. If there's people that in your community that are really isolated because of COVID, they have to have COVID and be isolated because they need to be in quarantine or they're sick with COVID. If they are unable to get food for themselves, they're unable to order through like a P-Box service through Stop and Shop, like if they just have no way of getting food, community can request. So either through emergency management or whoever your point of contact in town that would be handling that can reach out to us here at the office. And there's these boxes of food that we have that are for 2 people that last for I think it says a week, but I would say more like 4 to 5 days. That's all shelf stable food. We have that program going on. It's limited. There's certain restrictions public health has put on there, but Bonnie, my manager, is the person that's kind of been in charge of that in our office, and she sits on the working group with that. So if you have a need, you can call our office and speak to Bonnie and she can help. I think starting in February, they said they're also going to include, there's a gift card option. So you can either get a gift card to purchase food to say if you have a special diet, you have allergies, gluten, whatever the case may be. And you need to be able to purchase the food that you can have. There's starting in February going to be a gift card option as well if the box doesn't work for you. So any other questions about that, you can definitely feel free to call and we can help out and try to answer any questions.
Thank you.
Yeah, absolutely. I apologize. I have to hop off right now. It seems like there's so many meetings now since we can't meet in person on Zoom. So I got to go. But definitely feel free, anybody. I know sometimes, things come up later. If something else comes up in the meeting, or if you have a question or something for me you think of later, don't hesitate to shoot me an email or give me a call at the office here. I'll be here all day today and tomorrow. So be more than happy to help out with anything I can.
Okay, thank you, Kristen.
You're welcome. Thanks, everybody. Take care.
Bye, Kristen.
Bye.
Okay, so that is it for us on new business. Does anyone else have anything they'd like to bring up? Take that as a no. We have nothing on old business. So with that, I believe our next meeting is scheduled March 25th at 9:30. It'll be remote again, as far as we know. So at this point, I will entertain a motion to dissolve the meeting.
I second it.
Moved.
I second it.
Okay, Charlie? All in favor?
No, we have to do a roll call.
Yep, go ahead.
Not too many left.
Doug Moglen is not here. Carl Steinhardt's not here. Charlie Dunlap,
Here.
Russ
Second it.
Anderson.
Present.
It's a yes or a no because we're adjourning.
Yes.
Rich Stefanowitz,
Yes.
Tammy Spencer,
Yes.
Yeah.
Brett Banish,
Yes.
Randall Brown,
Yes.
Cindy Sullivan, yes. Jen Willard left, didn't she? Well, she can't vote anymore.
Yeah, Jen left.
Steve Presnell,
Yes.
Dennis Clark,
Yes.
and Karen Zorick.
Yes.
Okay, thank you.
Thanks.
Thanks, guys.
Thank you all.
Have a good day. Bye.